Hello everyone, and thank you for joining us for Enloe Medical Center's Healthier You Facebook Live, where today we're going to talk about how robotic surgery helped make a procedure possible on the day of the campfire. 49 patients from Adventist Health Feather River, as well as other evacuees, arrived at Enloe Medical Center the day the campfire broke out on November 8th, making it the busiest day of the hospital's history in 105 years to date. Caregivers knew more would be coming and worked diligently to make space. For some, that meant delaying non-emergency procedures and surgeries to keep beds open. Luckily, Dr. Mark Garrison was able to make it possible for a patient to, in pain to have her scheduled procedure using Enloe's Da Vinci robot. Hello everyone, my name is Susie Lowry Hall, and I'm Enloe's Community Outreach Coordinator, and I'm here today with gynecologist Dr. Mark Garrison, thank you for being here, and his patient, Colleen Sweeney, hello, to talk about their experience and how robotic-assisted surgery helped Colleen. So before we get started, please know that the information we're about to share is not intended to be medical advice. If you have any specific questions about your health, please talk to your healthcare provider. But as always, if you have comments, go ahead and post them in the comments field, and we'll do our best to answer them throughout the broadcast. So with that, we'll get started. So thanks again, both of you, for being here. Really appreciate it. My first question is for you, Dr. Garrison. Okay. Before we dive into robotic surgery, can you tell us what procedure Colleen needed and why she needed this procedure?
She needed a hysterectomy because she was having pain and she had a large pelvic mass. That pelvic mass turned out to be uterine fibroid. She also had ovarian cysts that were due to endometriosis. Susie, she had blood blisters inside of her.
God.
And so the lining of the uterus builds up with the influence of the hormones. And as the hormones tell the lining of the uterus to grow, they also tell the endometriosis to grow. So it starts out at the beginning of the month thin, and by the end of the month, when the lining is thick like this, it's like a blood blister, and it hurts. And then the endometriosis can cause chocolate cysts.
Oh, why is that? Why is it dark like that?
Because it's full of blood. It grows inside the ovary. And poor Colleen had an endometrioma, which is a chocolate cyst growing on the ovary.
I had no idea.
And it replaced the ovary. It replaced the ovary.
Wow.
So those are the two most common reasons, fibroids and endometriosis, for hysterectomy.
Yeah.
Cramping and bleeding and pain. And endometriosis is famous for causing pain with intercourse. Endometriosis tends to occur behind the uterus, in this area right here.
I'm loving your books.
So do you see this area right here?
Uh-huh.
That's where endometriosis typically grows, is right along here.
Right here?
Yes, right in there. That's the lowest point in the pelvis. So if you stood up, this would be the area that the blood would naturally collect. So the endometriosis begins to grow here. This is the vagina. It's lined right up with that area that would be painful.
Yeah.
Exactly.
Oh my gosh.
So the only way to make the diagnosis of endometriosis is with a scope in the belly. Putting a scope in. Now you notice these instruments are straight. With the robot, the ends articulate and they move like a wrist. So you can get into the bowl and get what you want. Imagine that you have a bowl of rice and you're eating it with chopsticks.
Sorry, I just got really excited about food. Sorry.
How hard is it to get to those angles? You have to angle everything in torque.
Right, you move the bowl.
Yes.
Right, that's how
Or
they do
you
it. They
can
move the bowl, they don't move the chopstick, right? But you can't do that with a human. You can't
You
like...
can't do that
can't
with a human. You can roll the bowl this way
in like
and get the
Japanese,
most
they move the bowl.
ergonomic. Yeah, you can get the most ergonomic advantage by rolling the bowl this way because it's curved.
Yeah.
The pelvis is also curved like a bowl. So these chopsticks, these straight instruments, although they're great for making a diagnosis, they're hard to use for treatment, like doing a hysterectomy. Whereas the robot gets in 3D, articulates the arms, and you've got 10 times the magnification. With the straight stick, it's 4 times.
Yeah.
So if I were to show you the different types of fibroids that can occur, they're named based on their location. And the type of fibroid that Colleen had was like this, and it went all the way to her belly button. And so the robotic surgery allowed me to get around that large fibroid that would have been very difficult to do with the standard laparoscopic hysterectomy. And really the next option would have been for her to have had an incision to be cut open and do it the old-fashioned way.
So we've talked about who makes a good robotic surgery in Facebook Lives in the past, but can you remind us of this? Like, what made her a good candidate for that?
What made her a good candidate for it was the type of pathology that she had. If she didn't have such severe disease, it could be done potentially a different way.
Okay.
If there was a smaller uterus, it could be done straight vaginal.
Okay.
We try and get away from doing incisions because they're so painful for the patient, and the recovery is so much longer, and there's a greater degree of blood loss and complication. The other thing is that a doctor doesn't have the magnification with the unaided eye, like with an open case. With the robot, I have 10 times the magnification, and I have stereoscopic vision that allows me to be in a virtual experience within the belly of the patient.
Wow.
I operate with my eyes, my head, my hands, and my feet.
Wow, that's amazing. So can you take us back to the day the campfire broke out? What was your reaction to the disaster? Did you think you would have to cancel Colleen's procedure? Yeah, tell us
Well,
about
you know,
that.
in the early part of the morning, I was in surgery, and so I didn't realize that this was a problem. After noon, it became evident that the hospital was filling up with patients rapidly being transferred from Feather River Hospital, from the nursing homes and other places, and not to mention those that were injured from the campfire.
Right.
And so Angela Sidney, the director of the OR, came to Colleen and I and said, can you be sure that this patient won't need to stay in the hospital? Because if she does, she's going to have to stay in the hallway. And you know, this is a large uterus, and it's a challenging case. And I said, Colleen and I talked, and we talked about rescheduling it. And we both felt like her pain, the symptoms she's having, the ongoing bleeding, that let's just go ahead and soldier on.
Okay.
And sure enough, I was able to do it all robotically, and she was able to go to home that evening.
Wow.
That day, you know, right after I was done from the surgery.
Wow. And is that normal or?
That's untypical. It used to be that even doing laparoscopic hysterectomy, I would need to keep the patient in the hospital overnight at least.
Wow, that's amazing. So, Colleen, what was your reaction when you heard about the fire? Did you think your procedure would be canceled, or?
I didn't.
Oh.
You know, I was kind of concentrating on the surgery and getting ready for that. And I just thought the fire was on the backside of Paradise. I didn't know that it had actually entered the town. And when you come to the hospital, you're insulated, and I was kind of in the same spot.
Yeah, unaware.
Yeah, okay. So, yeah, when I found out, it was...
Right. So how did her procedure go? So how did
It went textbook classic. It went very well. I was able to get down to the problem of endometriosis, remove it, remove the endometrioma, and then free up the blood supply to the uterus. And then everything came out in a bag through the vagina.
Wow.
Through a natural opening.
And you got to go home that day.
I did.
That's amazing. So, Colleen, we've heard that robotic-assisted surgery reduces pain and recovery time. What was your experience like, if you don't mind sharing with us? How did you feel after your procedure? How long did it take for you to feel normal?
You know, it was easy. I was able to walk immediately. And, you know, they
That's
put me in the
impressive.
wheelchair.
That's really
but
amazing.
To go from
That's-
the wheelchair to a car was
Yeah. And is that pretty normal?
Yeah, so
be able to walk?
I've never had hysterectomies not require narcotics. So this is another advantage for the patients, is that they can avoid narcotics.
That's amazing.
Yeah, and
Right,
I use a
essential.
nasal spray of ketorolac, which is like Toradol. It's a non-steroidal anti-inflammatory. It's a cousin to Motrin.
Oh.
And they take it nasal instead of by IV or IM, and it's a non-narcotic that reduces pain, just like getting Toradol in the hospital.
That's so amazing. We've come a long way in medicine.
We have.
That's really impressive.
In medicine, the questions remain the same. It's the answers that change.
It's so cool. So how are you feeling now?
I'm feeling very good. Very, very good.
Yeah.
And, yeah.
We like to hear that. That's great. Yeah. So, Colleen, would you recommend robotic-assisted surgery to others?
Why not? I mean, why not?
It's the next wave of technology and progress in surgery, and minimally invasive surgery.
Well, and it sounds like it was really beneficial, right? So you got again, in and out, which you've been practicing for how long?
I've been practicing for 33 years.
Yeah, and how often have you seen one of your patients go home day of?
Well, you know, before robotic surgery, I didn't see it. I tried doing it, and patients really kind of had a tough time trying to go home the same day. And so I just gave in and said, okay, you're going to stay overnight. But with the robot, it's not necessary.
Yeah, so I know you have a book over there, and I'd love for you to show kind of a little bit of the history about how that used to look when we talked about conditions that Colleen had.
So
we have multiple, yeah, go ahead, share.
Yes, it used to be that we would cut patients open to do the hysterectomy, and we would use large clamps, and it was an unaided eye, and you did the best you could.
Yeah.
And then we progressed in the 1990s to laparoscopic assisted surgery, and it was a step forward, and there was 4 times the magnification with the laparoscope. The problem is that the pelvis is like a bowl, and the instruments are straight. And when we have a bowl of rice and we're eating it with chopsticks, we can move the bowl, but we can't move the patient like that. And so there was difficulty in angling the instruments properly. With the robot, it allows for insertion of the instruments and then rotation, like a wrist. So you get into areas much easier, and 10 times the magnification. With stereoscopic vision, I have a lens to my left eye and my right eye that gives me this 3-dimensional image that allows me to be more accurate with the surgery. And so robotics is a big step forward, not only for the patient, but also for the advantages of the surgeon.
It's amazing. It's really exciting. And I'm glad that you feel good.
I do.
So thank you both so much. This has been great insight. And thank you, everyone. But is there any other words of wisdom you wanted to share with us before we sign off for today? Anything else you want to say?
I think that's it.
That's it.
Thank you, Colleen.
Thank
Appreciate
you.
it. Thank you for being here.
And thank you. So thank you, everyone, for joining us today. Really, it was an absolute pleasure. Thank you,
Thank
Dr.
you.
Garrison, and thank you, Colleen, for sharing your story. It means a lot to us. So, but before we sign off, everyone jump out your, not jump, but grab your calendars, because we have an opportunity for you to come and meet Dr. Garrison and any other of our robotic surgeons here at Enloe Medical Center. So you are invited to join us to our open house on Thursday, July 11th from 5 to 8 p.m. at the Enloe Conference Center. We hope to see you there. You can drop by this free event, maneuver the arms, you can check out the demo robot, and then we'll also be serving some light refreshments and appetizers for you as well. You can get more information at www.enloe.org/events for full details and registration. And until then, we'll see you next month for Dr. Jeff Lebowski on July 25th. And until then, take care.
Thank you.
Thank you.